Life for me with urgency incontinence is a constant awareness of my bladder, this constant fear of wetting my pants, to put it bluntly.
I kept clothes in my car, and very often I would have to go out and get them and change clothes because I was not able to control the urine that fell out of me. I actually spilled a glass of water in my lap at a meeting to cover the fact that I had leaked during the meeting.
Last summer I started to go see a urologist, and I said, yes, you are retaining urine. This is not a good thing. This could damage your kidneys. This is not a mere inconvenience.
Well, this is the bathroom, and this is where I used to come quite often. Oftentimes my coworkers would see me running down the hall to get into this ladies' room here, and it was quite embarrassing.
How much has your life changed because of overactive bladder or urinary retention? Have you tried other therapies such as medications without success? Do you often wake up to urinate several times a night? At work, do you worry about getting to the restroom on time? Have you reduced or given up exercising or other activities you love? Do you bring pads and a change of clothes wherever you go? You are not alone.
Bladder control is actually a huge problem in the United States. Roughly somewhere between 17 to 30 million people in this country suffer from some sort of bladder dysfunction. You need to treat this appropriately because you need to get on with your life, number one. And if you don't treat it, a lot of times these symptoms can become worse.
Not only am I aware of my bladder, but I have so many triggers throughout the day. For example, brushing my teeth. I often have to set my toothbrush down on the edge of the sink and head to the toilet. When I'm washing my hands at the sink in the kitchen, I have to run to the bathroom. Doing laundry. When I get ready to start the clothes washer, I haven't even started it yet. But knowing that the water's going to start running, it's an automatic trigger. I have to head up the stairs.
You may have tried pads, fluid and diet changes, Kegels, or medications, and still not gotten relief from the distressing symptoms, or else couldn't tolerate the side effects.
We tried Kegel exercises, didn't work. We tried biofeedback. I worked hard at it. Didn't work. We used medications, I think 4 or 5 of them. None of them worked.
I thought, well, I'm drinking too much fluid. So I stopped drinking. But I was on that medication that gave me dry mouth. Now, you're not drinking, and your mouth is the Sahara. You have to have gum in your mouth, or a lifesaver in your mouth. Your breath smells terrible.
I shouldn't have to just live with this. I shouldn't have to be told that, well, there's nothing else we can do, catheterize for the rest of your life.
Even if managing your fluids, pads, medications, and exercises have not worked for you, there is another option that offers hope. It's called InterStim therapy for urinary control, and it has helped thousands of people gain control of their bladder control problems since receiving FDA approval in 1997. In this video, you'll meet women like you who have made the choice to try InterStim therapy. You'll hear about their experiences and learn how the therapy works to help control bladder function. Could InterStim therapy be an option for you? You'll see how a short trial assessment administered by your physician can answer that question.
What we're saying about patients with these problems is that they have an information management problem. The switch is either stuck in the go all the time position or in the no-go position.
If you have overactive bladder, medications are designed to relax the bladder muscles, which may reduce symptoms of overactive bladder. But medications are not effective for everyone, and they can also cause intolerable side effects, such as dry mouth and constipation. If you struggle with retention, catheter tubes are often required in order for you to empty your bladder. It means having to keep catheters with you at all times and the risk of getting an infection. InterStim therapy can help for either overactive bladder or retention. It works on the nerves that control bladder function. The bladder itself may not be the primary problem, but the communication signals between the brain and the nerves that control the bladder are causing the troublesome symptoms.
And so the therapy can work equally well for both sets of problems. And the key to understanding who it's going to work for is the trial.
InterStim therapy begins with the trial assessment procedure that may be done in the office or as an outpatient procedure. During this procedure, a thin, flexible wire is placed underneath the skin near the tailbone, and then it's connected to an external test stimulator that may be worn on your waistband. The patient experiences the effects of sacral nerve stimulation during the at-home test period. Lorraine has suffered from frequent and sometimes uncontrollable urination problems for several years, and she is about to start the InterStim therapy trial assessment.
The first phase is a trial or a temporary phase. That's the part where we actually find out whether or not the use of this device can help you. What's involved is we put a small lead or a wire into the openings in the tailbone where the nerves travel. Then we're going to send a small electrical signal to the nerve with a handheld stimulator. So it's not the kind that ultimately we would implant in your body if this works, but it's a temporary one that patients can use in order to test this out. What we do in the operating room is not going to give us the answer. It's what's going to happen in the days following that, where you have a chance to use the therapy, and you're going to keep your diaries, and we're going to compare those to what was happening beforehand. In the right patient, in the patients who this can work very well for, we're not looking for a subtle change. We're looking for a night and day difference in your symptoms.
Today's the 5th day after my implant. I'm feeling terrific. I feel like I'm back to normal with regard to voiding. In fact, my bladder diary reflects that. I've had no incidents of leaking. Even today, I was brushing my teeth, and I didn't have to stop and lay the toothbrush down and run to the toilet. This is the first load of laundry I've done since the implant. So we'll see what happens once the washer starts. The setting is all right. Change it to cold. This is when it usually happens. Nothing.
Given that there was a trial, I was very secure with the fact that it wasn't going to be permanent, that we could have that trial period. My test stimulation period was interesting. It involved a lot of different changes to my settings to try to figure out which one was going to work, and nothing seemed to be doing the trick until the day before the end of my trial, which was a great success for me because it took a little bit of time to settle in.
A friend of mine called me the other day and wanted to know how I was doing. And I said, she asked me, I said, well, I'm still back where I was. And she said, what were the chances that this was going to be successful? What were you told? And I said, 70%. So she said, well, that's very, very good. And she said, but I kidded her and I said, well, maybe I'm in the other 30%. And she laughed and she said, I can't tell you how many times I've been in the other 30%. And you know what? Even if you are, it was more than worth trying this. And I said, oh, absolutely.
I didn't notice it was working. I noticed I wasn't wet. Hello? It was amazing. I hadn't been dry for a whole day in almost 28 years. When I realized I wasn't wet, I had hope. That 4-letter word was mine.
If the trial provides you with significant relief of your symptoms, you have the option of moving on to a long-term solution with InterStim therapy. During this procedure for long-term InterStim therapy, a wire, often referred to as a lead, is connected to a neurostimulator that is implanted underneath the skin in the upper buttock. The system is then entirely beneath the skin, and the neurostimulator continues to send the mild electrical pulses that help control your bladder function.
So looking at your diaries, the average amount that you were urinating was about 130 cc's, or 4 ounces, 4 1/3 ounces. And now you're voiding 330 cc's, which is about 11 ounces. So much bigger volume, and it goes along with the decreased frequency. So I think that how you feel and what those diaries indicate show that you are a good candidate for the chronic implant, and we should go on to that at this point.
Thank you.
Oh, sure, you're welcome. I'm really glad. It makes me feel great when I have a patient like you who I know I've been taking care of for a long period of time, and who we haven't been able to make better with the other things that we tried, that this works.
I love to run and was only really able to run short distances. Any movement to the bladder was just, would set you off with regards to feeling like you had to go to the bathroom. After InterStim, it's like I never had that problem before. I can stay at the gym as long as I want, and I even ran a half marathon just because I didn't have to deal with that anymore. I think of all of the things, I am the most proud of that moment. 2 hours and 28 minutes and 13.1 miles in 20-degree weather. You know, I did it because of InterStim. I don't think I could have done it without it.
Since the InterStim therapy, I don't even have clothes in my car. I don't need them. If I leak, which I still do sometimes, it's such a little bit. That's what the adult diaper is for. So you think these go with this?
I do.
I am able to sit through a meeting without having to leave. I can stand around at the end of a meeting and visit with somebody. I was always waiting to find the next bathroom. Now I'm waiting to find out what's going to be part of my life. The bathroom is not a major part of my life anymore.
The individual who is looking to learn more about InterStim, they have to be definitely open to the possibility that this may or may not work for them. I had been through 10 different possibilities and nothing worked for me until this, but I think I'm more than happy that I kept trying, and ultimately I found something that worked for me.
If you'd like more information about InterStim therapy, talk it over with your doctor. You could be a candidate for the trial assessment. Not all patients respond favorably in the trial assessment. If that is the case, the wire can be removed and you can move on to other options. InterStim therapy is completely reversible and can be discontinued at any time by turning the device off or removing the device. This therapy is not for everyone. Talk to your doctor to determine if InterStim therapy is right for you. As with any therapy, InterStim therapy is not without risks. In addition to the risk related to a medical procedure, complications from this therapy can include pain, infection, transient electrical shock, lead, thin wire migration, and adverse change in bowel function, among others. These complications were generally resolvable in the clinical study. Complications can also occur with the trial assessment, including movement of the wire, technical problems with the device, and some temporary pain.